Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot. It's going to be very short, just about 10 slides, but we're going to be going over just important concepts to know for the PNVN student, whether you are studying for your exit exam or for boards. Just important things that have been seen very often enough that I'm talking about it, that you need to know. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There, I have so many great resources available for you. I have my audio lessons. I have my new book that is out, Nexus Nursing's NCLEX RN cheat sheets. And in that book, it's basically a compilation of study guides, but I point out to you the most important things you need to know before you go take that test. If you don't know anything else, you better know what I have highlighted in that book. If you haven't gotten yours yet, be sure to go to my website and order yours today, nexusnursinginstitute.com. Very shortly, the one for PNVN will be out soon. So, guys, I'm seeing your emails, I'm seeing your DMs. I'm only one person, but it's coming out soon. Give me a couple of weeks. The one for PNVN will be out again, nexusnursinginstitute.com. That's the website where you can get your copy. Also, you can find me covering a variety of topics across my social media platforms almost daily. TikTok, Instagram, Facebook, YouTube. My handle is the same everywhere, Nexus Nursing. So be sure to check me out. Without any further ado, let's get started. Okay, first question. Concepts for PNVN students. Select all that apply. All right, loop diuretics lead to profound excretion of what? Let me move this out the way for you. Select all that apply. Here are your options. Water, sodium, chloride, potassium, calcium, magnesium. Again, loop diuretics lead to profound excretion of which electrolytes? Select all that apply. What do you guys think? We're talking about loop diuretics. If you're not into the Kahoot room, you can just type on the live what you think the answer is. All of them, guys. All of them. When it comes to loop diuretics, all of these electrolytes are lost in the urine. Now, with that being said, the fluids, sodium, chloride, potassium, calcium, magnesium, if you had to choose two that take priority over all of the other electrolytes that are lost in the urine, what are the two electrolytes that you guys would choose? Tell me on the live. Type in your answer, guys. Tell me. You have to choose two electrolytes. Which ones take priority? Which two would you choose? Are you guys shy? Okay, no one's answering me. So let me tell you what the answer is. When it comes to two, if you have to prioritize, every single day of the week, it's going to be sodium and potassium. The matter of fact, let's say we're not even talking about loop diuretics, just across the board. When it comes to electrolytes, most of the time, it's going to be sodium and potassium. They're going to be prioritized over the other electrolytes. Most of the time, not all of the time. Okay, because sometimes we're talking about maybe if the patient has a disorder such as I'm trying to think. Maybe if there is a disorder with the parathyroid, right? Then we're going to be concerned about calcium or something like that. But just generally speaking, if you have to guess and you don't know what the answer is and you have to prioritize, the two is going to be sodium and potassium. Now, out of those two that I just told you, you're going to prioritize. What if you have to choose one out of those two between sodium and potassium? What are you going to prioritize, guys? If you have to choose one between sodium and potassium, what are you going to prioritize? And whenever you're thinking about prioritization, remember, you have to think about what's going to kill your patient the fastest or keep them alive the longest. So guess what you're going to be prioritizing? It's going to be potassium. Potassium, whether it's too high or too low, remember your therapeutic range is 3.5 to 5, right? It will cause cardiac dysrhythmias. It will kill your patient a lot faster than sodium being too high or too low. Okay? All right, let's move on. What is the number one way to assess changes in fluid status? Would it be INO? Would it be daily weights? Would it be skin turgor? Or would it be taking the patient's blood pressure? So let's say your patient has a condition such as congestive heart failure, or they have diabetes insipidus, or they have SIADH, whatever. They have a condition where you really have to monitor and pay attention to the changes in that patient's fluid status. What is the number one way to assess a patient's fluid status? Would it be INO? Would it be daily weights? Would it be skin turgor? Or would it be blood pressure? By the way, guys, those three conditions that I just mentioned to you, you also need to know that for NCLEX. You need to know that those are conditions that you're going to be very closely monitoring the patient's fluid status. Daily weights. Very good. Daily weights. You are going to take that patient's weight using the same type of scale, same type of clothes, same time in the morning. Okay? Daily weights. True or false? Hydralazine is used to treat mild to moderate